Hi, good morning, students. Welcome to the sessions in oral pathology. I am Dr. Gopi Krishnan discussing with you oral pathology here. Okay, so in the previous videos, we have seen the developmental anomalies affecting various structures in the oral cavity. Okay, in this video, we are going to discuss about the developmental anomaly affecting the shape of the tooth. Okay, so you know that the tooth, your incisor, canine, premolars, or the molars, they have a defined shape. Okay, so any alterations in the shape of the tooth, okay, while its development is coming under the developmental disturbances. So here you can see there is a few terms, that is the developmental anomaly affecting the shape, that is gemination, fusion, concrescence, etc. Okay, so let's discuss the developmental anomalies affecting the shape. So first one which I wish to discuss here is gemination. Now you may relate this term to germination, or something that is sprouting, or something that is growing. Okay, germination. So you know that a tooth bud, okay, one tooth bud will give rise to one tooth. Okay, we have one tooth bud that will give rise to one tooth, right? But if this tooth bud, by any course, by any developmental course, will try to divide into two. Okay, if a tooth bud which will try to divide, okay, it will try to divide into two. So what will be the result? We will get a tooth with a division in it. Okay, that will give a rise to a tooth which have a division in the crown or in the root. Okay, so it's a single tooth bud, but it will look like two tooths. Okay, I will show you the image here. Can you see this picture? Okay, look carefully to this picture. Can see the central incisor here, both central incisors, and you can see that in the center there is a division. Okay, so it is like it was a tooth bud, it has tried to divide it into two. Now what is the result? The result is that they have a split crown. Okay, the crown appears to be splitted, so this is called a gemination. Okay, and what about the tooth number here? Okay, there is no change in the tooth number. The person will have a single tooth here. Okay, single tooth here, it is not divided into two, it is not completely divided into two. The tooth number appears same here. Okay, the tooth number in this patient, the tooth number, the total tooth number remains unchanged. Okay, that is the key point, that is the question. In gemination, the total tooth number remains unchanged. Only thing is the crown has a division and it will look like a two different tooth. Okay, so can you see here? So this is a radiograph where you can see that the crown is divided into two, but you can see a single root canal. Okay, the root canal is just single, and you can see that. So this phenomenon is called gemination. So let's finish. This is gemination. And what about the tooth number? The tooth number, the total tooth number remains unchanged. Okay, that is a key point. Okay, so we have a bifid crown and a single root. Okay, now next one, let's see the next one. Okay, the next one is called fusion. The next anomaly I'll call it fusion. Now by the term itself you know that fusion, it is fusing. So we have two tooth bud here, tooth buds. Okay, we have two tooth buds. Okay, so there is one tooth bud here and the other tooth bud here, and they will fuse together and to form a single large tooth. We have a single tooth bud. So normally what should have happened in normal condition, what should have happened? The this tooth bud should have given a tooth, and this one should have given a tooth. But what happens as they fuse together, they form a single large tooth. Okay, so single tooth is formed. Okay, now what happens in this condition? What about the tooth number in this condition? Okay, what will be tooth number? Instead of two, we are getting a single tooth. So the tooth number, the final tooth number, what will happen to the number in the patient? It will be reduced by one, right? Reduced by one. The tooth number is reduced by one. Okay, that condition is called fusion. So you can see in this image, I can show you that in this image you can see that we have a premolar here, we have a canine here, we have an incisor here, we have an incisor here, we have second incisor here. So in the midline we have only we have two incisors in this side, two incisors are there in this side, where it is only one incisor here. So where is the other incisor? It's gone, right? So in this side it is gone. Okay, we have canine here, premolar here. Instead of two incisors on that side, on that right side of the patient, we have only one incisor, which means that the tooth buds of the incisors are fused together and it emerged as a single tooth. Okay, so it is gone. So you will lose a number when there is fusion. Okay, so this is one another important thing. Now the third one, the third developmental anomaly, that is called concrescence. Okay, so concrescence, what you mean by concrescence? So concrescence is that the two tooth buds or two tooth which will fuse only at the level of cementum. Means in concrescence there is one tooth bud is there. Okay, there is one tooth bud, a single tooth bud is here. There's another tooth bud. Okay, there is the another tooth bud is here. Now what do they will do? They are not going to fuse in the bud stage, or when they are not going to fuse when they are developing. They will form individual tooth. They have formed individual tooth, and these tooth will fuse only at their level of cementum. Okay, cementum, it's only fused at the level of cement. It's like we have sticked two tooth with feviquick, right? If you take a concrescent tooth outside and see that, we will feel that these tooth are stick together with a glue. Okay, because the cementum, they are only fused in their cementum level. They have a different crown, they have a different root, they have different dentate, but these two tooth have fused only in their cementum level. Okay, that is concrescence. Okay, so there is you can see the image. I will show you the image and it will be very clear to you. Can you see this image? See this image. These two tooth here, they are totally different, and you can see that only the cementum in their roots has a stick together. Okay, that is concrescence. Okay, this is called a concrescence. So don't confuse. It is concrescence. And there's an interesting thing here. You know, developmental anomalies does not occur due to inflammation. Developmental anomalies. Why we call it developmental? The developmental anomalies occur at the time of development without any other stimulus. Okay, so inflammatory lesions or inflammatory diseases occurs due to inflammation, but concrescence is the only developmental disorder or developmental anomaly which is supposed to be raised due to an inflammation. Okay, so inflammation, if the tooth has some kind of inflammation at the time of development, if the tooth bud has some kind of inflammation at the time of development, it may lead to concrescence. So concrescence is the only developmental anomaly. Okay, developmental anomaly which is supposed to be due to inflammation. Okay, so that is one very important point. Okay, so they can ask you a question in that. So we have seen the main three developmental anomalies here. Okay, so what was that? We have seen the developmental anomalies. It is okay. We have seen gemination, we have seen fusion, we have seen concrescence. Now let's see the next one, that is accessory cusp. Okay, what do you mean by accessory cusp? Accessory cusp. Accessory cusp means some extra cusp in the tooth. Okay, so you know that the normal tooth has normal number of cusp, means your maxillary tooth has four major cusps and one small extra cusp. Okay, and your mandibular tooth has five cusps. Okay, the mesiobuccal, mesiolingual, distobuccal, distolingual, and the distal cusp. Okay, so they have a normal anatomy. But if a tooth has something extra than that, you know that in a premolar there is a buccal cusp and a lingual cusp, right? In premolars there is two cusps. Okay, so if something extra is there on the surface of enamel, some extra enamel is there, we call it accessory cusp. So accessory cusp, we will learn there are three types of accessory cusp. First one is very famous, that is your cusp of Carabelli. Cusp of Carabelli. You may have heard about the term cusp of Carabelli, right? Cusp of accessory. Okay, cusp of Carabelli. What do you mean by this cusp of Carabelli? Okay, no, this is a extra cusp. Cusp of Carabelli is extra cusp. Where it is coming? It is coming in the palatal surface. The palatal surface of which one? Mesiobuccal cusp. Mesiolingual cusp in the lingual side, in the palatal side, okay, mesopalatal, or we say mesolingual. On the palatal surface of the mesolingual cusp, we have a extra cusp, and where it is seen? It is seen in the maxillary molars. Maxillary molars. So the extra cusp which is seen in the mesopalatal or the mesolingual cusp of the maxillary molars, we call it cusp of Carabelli. Right now, everyone knows about cusp of Carabelli. There is one another thing, what extra cusp seen on the mandibular molar is called. Okay, so there is a similar cusp is seen on the mesiobuccal, seen in mesiobuccal cusp of mandibular molar. So you may have all heard about cusp of Carabelli, right? There's an extra cusp which is seen in the mesiolingual cusp of the maxillary molar. Similar to this cusp of Carabelli, just like this cusp of Carabelli, there's an extra cusp is seen on the mandibular molars. Okay, that is called a protostylid. A protostylid. So remember these terms. Okay, these are all accessory cusp. Now, what is the next accessory cusp? You may have heard about a very famous accessory cusp. You may have heard the name of the syndromes with that cusp. Okay, so that is your Talon's cusp. Talon's cusp. You may have heard about a Talon's cusp. So many syndromes with the Talon's cusp, but extra cusp or is just like a elevation on the enamel on the anterior tooth. Okay, mainly just like a eagle's beak or eagle's talon. That's why it is called a Talon's cusp. Okay, it is looking like a eagle's eagle's beak, or we say eagle's talon. Okay, that's why you call it Talon's cusp. I will show you the image where we have the Talon's cusp. Yeah, this one. Can you see the image? Okay, that is very clear that in the anterior tooth, either it be the maxilla or the mandible. The anterior tooth usually have this talons cusp. You can see that the extra beak-like extension that is mainly on the lingual surface, of the anterior tooth, either be the maxilla or the mandible. Anterior tooth has a extension. Okay, so this is extending from where it is extending? It is extending from the CEJ, in the cemento enamel junction. It is extending to your incisor tip. Okay, so it is extending upward. Okay, it is extending upward, then we call it, this is called a Talon's cusp. Okay, so it is extending from the CEJ, and mostly it is seen in the maxillary tooth, but it can be seen in the mandibular tooth also. Okay, so I will write about Talon's cusp. What to study about Talon's cusp? It is usually seen in the maxillary permanent anteriors. Okay, permanent maxillary anteriors is the most common site, and mostly it is seen in the maxillary lateral incisors. Okay, maxillary lateral incisors are very common for it. Then comes your maxillary centrals. Maxillary central incisors. 50% of the cases, 50 to 55% of the cases, you can see it is coming in the maxillary lateral incisors, and nearly 30% of the cases it comes in the maxillary central incisors, but it can come in the mandibular incisors also. Okay, mandibular incisors and even the canines. Okay, nearly 5 to 6% you can see it in the mandibular incisors, and rarely in the canines also. Okay, the canines also you can see the presence of this Talon's cusp. Now, there is so many questions the NEET has asked in Talon's. Talon's cusp is a very important question point of view in your NEET examination. Okay, they have asked the classification of talents. They have asked the syndromes associated with talents. Okay, so after the our lectures in this developmental anomalies, we will solve the questions. Okay, previous year questions which has came in your NEET and INCT examiners. Okay, so the major question regarding the talents is the classification. Okay, classification of talents cusp. So many people has given classification of talents cusp. Most important is your Hattab classification. Okay, the Hattab classification is very important. Now, according to Hattab, the talents cusp can be divided. How can be divided? If this is a tooth. Okay, so I'm drawing a tooth here. This is a tooth. I have a tooth here, and I have a talons cusp extending from the CEJ, and how far they are extending, that depends. Okay, so here I have the CEJ. Now, how much height they are extending? Okay, if it is extending from the CEJ to more than half of the incisal, sorry, more than half of the crown. Okay, more than half of the crown length, then we call it a major talon. Major talon. Okay, so many other people has given different names, major talon, or someone called this true talon. Okay, true talon, major talon. If it is extending, if the talus cusp is extending from the CEJ to more than half the distance, okay, more than half the distance, we call it major talon. And if it is extending, if it is extending from CEJ to one third of the crown, we call it minor talon. Okay, so if it is just extending from CJ to one third of the crown, we call it minor talon. And if it is very less, if even less, even less than one third, okay, or we say if it is nearly 1 mm or less than 1 mm, we call it trace talon. Okay, so there is major talon, minor talon, and trace talon. Okay, so this is the term you should remember. TAP classification. I hope this is clear. Now, what next? Syndromes. I hope you are familiar with the syndrome. You may have seen our videos on syndromes. Okay, so in that we have discussed a very major syndrome which has talent cusp. That is your. Can you give an exercise to your brain? Can you recollect, revise? Okay, so revision is the key. Revision is the key always. Okay, you have to revise. Okay, revise. Always keep revising. Give exercise to your brain. So, which is the major syndrome where you can see talent cusp? That is your Rubinstein type A. Okay, Rubinstein type B is the major syndrome where you can see talent cusp. Then can remember other syndrome, that is your more. Okay, so talent is something more. Talent cusp is something extra, something more. So more syndrome, MOHR, more syndrome. Okay, more syndrome. Ellis Van Creveld, Ellis Van Creveld syndrome, Struch-Weber. Okay, Struch-Weber. So these are all certain syndromes where you can see talent cusp. Okay, so I hope talent cusp is clear to you. Can we move to the next developmental anomaly? Okay, the next developmental anomaly comes in the accessory cusp. So accessory cusp, we have seen cusp of Caraballi, we have seen protostylid, we have seen talent cusp, and the last one, some extra enamel or extra thing is seen on the crown, that is your dense evaginatus. Okay, dense evaginatus. Evaginate is something coming outside. Okay, there is two things: dense invaginatus and dense evaginatus. Okay, so in the anomaly you can see that there is two things, that is dense evaginatus, and there is one term called dense invaginatus. Okay, dense invaginatus means something invaginating, means going inside. Dense evaginatus means something coming outside. So I will show you the image and it will be clear to you. Okay, okay, can you see this tooth? Can you see the premolar here? Okay, I think it is very clear. Can you see, just locate this premolar. It has a buccal cusp, it has a lingual cusp here, but in the center it has some other projection. Okay, there's one extra projection on the premolar, what you see here. Okay, that is a extra external projection, that is called evaginatus. Okay, evaginating out. Okay, so let's see what is there in dense evaginatus. So dense evaginatus has many other terms. Okay, so it has a term called a central tubercle. Now, why I say the other names, synonyms, because you may not see the same term in the options. Okay, so there was a question in the previous NEET about a salivary gland tumor. Okay, so there was a question in and that salivary gland tumor, the name is very famous. Okay, the name was oncocytoma. Okay, and the other name of this oncocytoma is oxyphilic adenoma, and students they didn't knew the synonym for it. So in the options, instead of oncocytoma, they gave the option as oxyphilic adenoma, and students thought that, oh, this oxyphilic adenoma is something big thing that sir has never told us. Okay, so see, that's why I tell the other names also, because in the options it's their freedom, it's the freedom of the NEET or the INICT which term to be used. Okay, so you should be familiar with these terms. I don't want you to by heart these terms, but at least you should be familiar that, oh, this comes relatively here. Okay, so dense invaginatus, the other term is central tubercle, or the other term is occlusal tubercle. Okay, occlusal tubercle, or we say Lyon's premolar. Okay, Lyon's premolar, central tubercle. Okay, many other names. So this is a term. Now, what is this actually? It is just a cusp-like elevation. The cusp-like elevation that is on the enamel. Okay, the cusp-like elevation that is seen on the enamel. Now, mostly which where it is seen? It is seen in the premolars. Okay, premolars. Your mandibular premolars is the most important area. Mostly your mandibular premolars, most common. It doesn't mean that it doesn't come in other places, but most common. So whenever we say any place, anything most common, means that it is mostly seen, the incidence is mostly seen on that side. Okay, it doesn't mean that it will come only there. I always tell my students that pathology never read textbooks. Okay, pathology can come anywhere. I say that this tumor comes in the anterior part. So in the question, they may tell about a posterior part, but all the other description will be regarding that tumor. But sir has told us that this tumor comes in the anterior, sir, so this is not the answer. No. Okay, pathology can come anywhere. Pathology can come any places. Okay, the location is not the matter. We are saying the most common. We are using the term most common because the incidence is more in that side. Okay, so this is one thing. And why this is occurring? What's the reason for this projection? Because while the development, your enamel organ will project outward. Okay, there's a enamel organ outfolding. If the enamel organ is outfolding during the development, then this can occur. So this is about your accessory cusp. Okay, so hope it is clear. Now let's move to the next anomaly, where you have a what invading or invasion of your your enamel organ. That condition is called dense invaginatus. Okay, dense invaginatus, which means that while the development, the enamel organ has invaded inside. Okay, they have a fold inwards. Okay, so the tooth will also have a folding inside, just like that. Okay, so this was a normal tooth which was supposed to become. This was a normal tooth which was supposed to become, but now what it became? Now it is like this. A depression inside, a inversion inside. So you can see the tooth is what folding inwards. Okay, so this is called dense invaginatus. I will show you the picture and it will be more clear to you. Okay, yeah, can you see this picture? Yeah, see the radiograph in this picture. You can see that in the outer side there is enamel. Okay, this is your enamel here, and the enamel here that is folding inwards, right? Okay, I will erase and show you again. You can see that that enamel is folding inwards. You can see that there is a depression towards the root, right? So it is called invaginates. Okay, so can you see this picture? This is a type of dense invaginatus. You can see that from the crown it is going down, right, into the, okay, that is invaginatus, and it is mostly seen in the radiographs. And what happens? It is mostly due to the infolding. Okay, it is due to infolding of your enamel organ, right? And the most common tooth which you can see this is your maxillary laterals. Maxillary lateral incisors are the most common tooth where you can see the dense invaginatus. Okay, and there's three types. You can see three types. The type 1 is that the invagination is only within the crown and it has not reached till the CJ. So you can see this is a CJ. Okay, this is the CJ line. Cemento enamel junction is the CEJ, cementum, where the cementum and the enamel meets. Okay, that invasion is within the crown and it is not cross the CEJ, that is type 1. So in the type 2, you can see that, okay, this is a CEJ line and this has crossed, this invagination has crossed and came far down the CEJ, that is type 2. And in type 3, you can see that this invagination is having communication even at the root apex. Okay, so it is coming far down, that it is opening till the root. Okay, the invagination has gone further deeper and it is going down the root. Okay, now you can see in this picture that the tooth is having enamel even inside. Okay, one tooth is having invagination and it has enamel inside. It's just like a mother carrying a baby. It means a tooth carrying a tooth inside, so it is called a gestant odontome. Gestant odontome. The other name, it's a fancy name, gestant odontome or dilated odontome. Okay, it means that it is like a tooth within a tooth, a tooth within a tooth appearance. Okay, enamel inside the tooth. Okay, so that is the other fancy names for it. Okay, so this is about your dense invaginatus. Okay, so what all we have seen, your accessory cusp, we have seen dense invaginatus. And about ectopic enamel, ectopic enamel is very easy. Ectopic enamel means that the presence of enamel at a different place other than the crown. So what is the normal location of enamel? The normal, if I have the ectopic, yeah. What about ectopic enamel? The normal location of enamel is your, what is your crown. Can you see enamel in the roots? Okay, so the presence of enamel in root is called ectopic enamel. So the places where it is not supposed to be seen, that is ectopic. Okay, ectopic, by the term ectopic means that area is ectopic, means it is foreign to that side, right? So the enamel is seen in the roots, so we call it ectopic enamel. So what is the two ectopic enamel presentation? One is called enamel pearl. Okay, one is called enamel pearls. Enamel pearls are small round enamel which is present in the furcation areas of root. In the furcation area of roots, you can see small round structures, round enamel structures. Okay, that is enamel pearls. And the other ectopic presentation is cervical enamel extension. Enamel extension. Okay, so this is it is the extension of the enamel from the cervical CEJ region to the root. Okay, so that is enamel extend from CEJ, cemento enamel junction, to the roots. Okay. These two are the ectopic presentation of your enamel. Okay, ectopic enamel. If I have the image, I will show you. Let's see whether it's there. It's not that important, that's why I avoided. So the last one, the next one here we have to learn is the taurodontism. Okay, the next one is called taurodontism. Now this term you may have all heard about taurodontism. Taurodont. Actually, taurodontism, everyone has a misconception that taurodontism is something like a large tooth. Okay, see students, very clear, you should have the concept. There was a question about taurodontism in INICET, that how a taurodontism tooth appear in the oral cavity. Okay, so taurodontism, by the term taurodontism, you know that you may have heard that it's a bull-like teeth. Okay, bull-like teeth is the concept that most of the student has, that it is bull-like teeth, very large teeth, right? So how it will appear clinically, if a patient is coming to you, opening his oral cavity, is showing that see, I have a problem with the molar, and you are seeing that there's a tooth. Oh, that tooth, the taurodontism, in taurodontism, the tooth will clinically appear normal. Okay, you cannot identify taurodontism by looking in the patient's mouth. Okay, the tooth appear normal. That is a concept you have to remember. Okay, don't think that it will be a big large tooth in the oral cavity. Okay, so it is not a big large tooth. It is a tooth clinically the tooth look normal. It is of normal size. Okay, but what is the factor? What is the thing there? The enlargement is for the pulp chamber inside. Okay, the enlargement is seen in the body and pulp chamber. And the major definition, the major factor you should remember is that there is a apical movement of the pulpal floor. You know that there's a tooth. Okay, make the concept clear and go. Okay, yeah, we have a tooth here. So this is a tooth here. Okay, and what about the pulp chamber? Pulp chamber is like this. Okay, this is the pulp chamber, and this is the pulpal floor. So what I am marking here, okay, that is the pulpal floor. That is the floor of the pulp. So the pulp chamber, the floor of the pulp chamber. But in taurodontism, what really happens is that the tooth will be having a pulp chamber, very large pulp chamber. See, it's a very large pulp chamber, and the pulpal floor will be more downward, more apical. So we say it is an apically placed pulpal floor. Okay, that is the major thing in taurodontism. Okay, you see this image and you will understand better. Okay, can you see this first go to this image. Okay, can you see this image which I have ticked? Okay, that's a normal tooth. See the pulp chamber is fine. See the pulpal floor, what I am marking in the green is the pulpal floor. That is our floor. Okay, now when it is little more higher, we little more larger pulp chamber, and the pulpal floor has came little down, it's called mild hypotoron. Okay, mild, or we say hypotoron. Okay, and you see that pulpal floor has reduced little more down, and the pulp chamber has widened, so it is moderate or mesotoron. And you can see that the pulp chamber has further came down. Okay, the furcation, you see the root furcation. The root furcation was here, and now see here the root furcation has came down, the pulpal floor has came down. So that is the feature you see in taurodontism. The pulpal floor will come down, the pulpal chamber will increase. But clinically you cannot appreciate it. Clinically the tooth size will be, the crown size will be normal. Okay, can you see in this radiograph? This radiograph is very important. This is an image based question, IBQ. This is an image based question. Okay, you can see that you can see this tooth, the crown size is normal, and you can see that the pulpal chamber, just try to trace out the pulpal chamber. We'll try to trace this pulpal chamber like this, like here, and I have the pulpal floor coming here. So this much cavity, large cavity is the pulpal chamber, and the pulpal floor is very low, very apical. Okay, very apical. So this condition is called a taurodontism. Okay, this is taurodontism. Now the next question they can ask you in taurodontism is, what are the syndromes associated with taurodontism? What syndromes you see in taurodontism? What are the syndromes you can see in taurodontism? Okay, the first one, please remember, the taurodontism can be seen in your Klinefelter's. Okay, your Klinefelter's syndrome. In Klinefelter syndrome, there is taurodontism, and the next one in Down syndrome, you can see taurodontism. Okay, and in Ellis when crivelled, you can see taurodontism. And another important thing is, you can see taurodontism in another developmental anomaly. Okay, so there is two developmental anomaly coming together. Okay, in a developmental anomaly which affect the structure of teeth. Okay, the developmental anomaly which affect the structure of teeth, that we will be discussing in the next video. Okay, that is amelogenesis imperfecta. Okay, in amelogenesis imperfecta. Okay, in amelogenesis imperfecta, that is type 4. Okay, also in type 1e. Okay. In amelogenesis imperfecta, that is a developmental anomaly affecting the structure of the enamel. Okay. In amelogenesis imperfecta, there is different types, and the fourth type is amelogenesis imperfecta type 4, and there's a subdivision in 1e. Okay. So that in both two types, you can see that this is associated with the taurodontism. Okay. So these are the areas where you see taurodontism. So I hope it is clear. The last one here is the dilaceration. Can you see this tooth? What is the specialty? What is the defect with this tooth? Seeing the diagram, in the diagram you can see that the tooth is having a bend. Okay, it is bend, it is just like bend, and this condition is called a dilaceration. Okay, dilaceration means any abnormal bend in the tooth. Any abnormal bend is seen in the tooth, either in the tooth crown or in the tooth root. This happens when the tooth bud is having a trauma while the tooth is developed. Okay, so the tooth was developing, the tooth was half formed, the tooth bud got a trauma and it is just shifted from the position. So rest of the tooth comes at an angle to the previously formed. So this caused a bend in the tooth, abnormal bend in the tooth root, in the root or the crown. Mostly it is seen in the root. Okay, so this condition is called a dilaceration. So I have finished all the thing. Oh, this is the picture for ectopic enamel that we have missed. This is ectopic enamel. See, the enamel pearl means the extra enamel found in the what, where, in the roots. Okay, so this condition is called ectopic enamel, and here you can see this enamel is extending from the CEJ to the root. That is called a cervical enamel extension. Okay, these are the two ectopic enamels. Okay, so this brings the end for the anomalies in the structure of tooth, right? Sorry, in the shape of the tooth. So we have seen almost all. Okay, so other thing, accessory root and hypercementosis, that is not that important. Hypercementosis means increase in cementum. Okay, increase in cementum, and accessory root means an extra root. Okay, extra roots means, you know that molars, maxillary molar has 3 roots, mandibular molars has 2 roots. So any what increase in this number, sometimes the maxillary molars come with 4 roots. Okay, so any extra root we call it accessory roots. Okay, so we have seen most of all. Okay, gemination, fusion, concrescence. The accessory cusp, when comes the cusp of Carabelli, protostylid, talens cusp, dens invaginatus, then came dens invaginatus, ectopic enamel, which consists of enamel pearls and cervical enamel extension, taurodontism, and we have seen dilaceration also. Okay, so almost all we have covered. Okay, so this is the end of this video. See you in the next video with the next topic. Thank you.